It's time for our Health Watch. Dr. Syed Hussain of Trinity Health of New England joins us now. Good morning, doctor.
Morning, Symphony.
We have a couple of things to talk about. First up, the FDA plans to remove the black box warning on hormone-based medications for menopause. Why is this significant?
This is a big deal, Symphony. So just to recap what this means. So since 2003, the FDA has had a black box warning, which is the most stringent, strongest type of alert the FDA attaches to a drug. And the black box warning basically mentioned that hormone replacement therapy, pills, creams, patches that may contain varying amounts of estrogen may lead to a higher risk of stroke, heart disease, breast cancer, uterine cancer, and clots. So this was based off of a study that was done in 2002, funded by the feds. But there's been more data, more evidence now that basically tells us that hormone replacement therapy would be beneficial, and which led to the FDA removing this warning, which is a big deal, like I said. So prior to this warning going into effect over 20 years ago, there were 1 in 4 women who were using hormone replacement therapy, which then plummeted in the 2020s to 1 in 25. And we know that symptoms, perimenopausal symptoms, can be very debilitating. So this gives doctors the opportunity to offer this as a modality for treatment. Take-home message here for viewers, for women in particular, is make sure you have that discussion with your doctor to see if you're a good candidate. There may be some conditions such as history of clots or a history of breast cancer, which may, those folks may not be good candidates for hormone therapy. So making sure you have that conversation with your doctor would be key.
Okay, now this next one, it had Brendan and I both scratching our heads. Some new research from researchers discovered that toothpaste made from hair could regrow your enamel. Doc, break it down for us. How does this work?
Yeah, this is an interesting study out of the United Kingdom. So this is basically a lab study that looked at keratin, which is a naturally occurring protein found in human hair. So when keratin was exposed to minerals that are present in human saliva, for instance, it caused a really strong scaffolding to wrap around the tooth, similar to what enamel does. Now, enamel protects the tooth, but long-term use of, cola products and that last cup of coffee ultimately wear that enamel down in humans and leads to cavities and decay, tooth decay. And this is very interesting because it may be able to replace some of the long-term decline that we see in enamel production because it's not replaced. There's more research that needs to take place, but nonetheless, it is very interesting.
Alrighty, and lastly, we are in the thick of No Shave November. How does this help raise awareness for men's health?
Yeah, this came into being a few years ago, Symphony, 2009, I believe, when, and basically it is done to educate and raise awareness for men's health, particularly cancer in men. And so the premise here is for the month of November, men are encouraged to grow their beards and not shave, grow their hair, and donate the amount that you would use usually for hair grooming or hair products towards a cause that is associated with No Shave November to help awareness and education research for cancer in men.
All righty. Well, thank you so much for joining us this morning. We'll see you next week.
Sure, sounds good. Thank you.